Good morning. Happy Friday. Welcome to the Friday Informatics Power Talk series, and also Indigenous Peoples Weekend holiday weekend. I'm very happy to introduce today's speaker. I know her personally and worked with her for many years. She has more than 20 years of experience in health informatics and health sciences librarianship, and recently joined University of Illinois Chicago, UIC, as professor and associate dean and associate university librarian for health sciences. She oversees 3 health science libraries to support education, research, and clinical practice, and supporting their the 7 health colleges and their hospital and clinics and affiliated hospitals. She earned her Master of Arts in Library Sciences in 2003 and Ph.D. in Information Science and Learning Technologies and Master of Science in Health Informatics from the University of Missouri. She's also focused on human health information behavior, experience, and information systems evaluation adoption, all boiling down to helping with health information communication to facilitate patient access, management, sharing, and dissemination of learning and community health. She's currently networking in many collaborations locally, regionally, and she completed the Association of Health Information Libraries Leadership Program. I also know her personally. We both serve in Women in AMIA, where she serves as the steering committee chair. And she's also in the AMIA DEI task force. She's also a fellow of the American Medical Informatics Association, FAMIA. And her clinical topic is of interest to lots of people. I've seen many people signed up and registered and attending. Can ChatGPT answer clinical questions? What happens if we ask ChatGPT that? So without further ado, Dr. Tao.
Thank you, Amy. Good morning, everyone. Thanks, Amy, for the invitation, and also thanks everyone to join today's discussion. I'm very glad to have this opportunity to share some of my ideas, and also gain your knowledge and expertise regarding this one aspect of the AI impact on the healthcare. So, for the ChatGPT, I don't really need to say too much. People know how this works, and also know they have been utilized in various aspects in the teaching, education, research, and also the clinical practice. So, but here, the thing is, some questions about, can we use this ChatGPT to answer clinical questions? And what are the difference between using ChatGPT versus the traditional search engines like Google? So I cite this table. I think this is really provide a very nice summary about the differences between these two tools. I think the major difference is the ChatGPT is the self-learning. The information generated from ChatGPT can be based on the previous answer provided by ChatGPT itself. And the query base is not only based on the keywords. And so this really provides broader and more in-depth and also dynamic information for the users who have been inquiry from the ChatGPT. But there's also some questions like, it seems that ChatGPT's response can vary depending on the direction or the form of the user's questions, so that the responses from ChatGPT depends on the question refinement. So then come up with one question is with different ways of asking the same question, which receive different answers from ChatGPT, or maybe the quality of the answers will be different. So here, I want to kind of define what I meant by clinical questions here. So who actually ask these clinical questions? I'm more focused on the audience, but the target audience would be the patients or the general healthcare consumers. And they may ask health-related questions at doctor's office, or they may just, at their home or with friends, or, anywhere. But it's really coming from the patients or the general healthcare providers, consumers, I'm sorry. So the questions could be about conditions, diseases, diagnosis, treatment, prognosis, or maybe just some self-care, options. So they want to get basic knowledge about the disease, probably, or they want to know some techniques about how to self-care their own disease, or they want to find out the differential diagnosis information or seek the second opinions. And maybe by searching the information, by using the ChatGPT, they really want to find out, whether or not they can make decision on certain treatment plan. So, and also the question-wise, context-wise, or just general knowledge, or with very detailed context about the patient situation. So it may all be the, what I meant by the clinical questions. So I saw there's some studies investigating the questions asked by the healthcare professionals, which is not, not in this part of the discussion. So I'm more focused on the questions asked by the patients, because for the ChatGPT, I personally would think general people will use it. Healthcare professionals, so this is a question mark, whether or not they would use it as a sort of a tool for answering clinical questions, or they may just, they are the professionals, they are the experts, they don't need use ChatGPT to help, probably. So that's a question mark. But in my topic today is really the target audience would be the patients or the general healthcare consumers. So here come with actually two issues, or maybe the two questions or the problems are really related to answering whether or not ChatGPT can answer the clinical questions. It's about the evaluating the ChatGPT's performance in answering health-related questions. Or do the types of the questions have any associations with the quality of the answers provided by ChatGPT? So I kind of do a relatively comprehensive literature review, but I just feel like the more I read literature, the more need to dig, and then the more I want to know. So what have been done in regarding the evaluation quality of the answers? So what I found so far is a lot of studies are to assess ChatGPT's performance in answering clinical questions on a specialty subject areas or a disease, or maybe like a operation, like a surgery. So for example, the cancer, colon cancer, or the myopia, this really disease specific, or the type of operation specific. So there is really, which means it's very contextual specified evaluation. And the methods wise, while many of the studies use, the health professionals to rate the answers, ChatGPT generated answers on the accuracy or the completeness of the answers with Likert scale. And the questions come from either publicly posted questions, health-related questions on social media, or physician-generated questions, or just the researcher, based on just for the research purpose, researcher-generated questions. And then the findings actually are not consistent. So some studies provide positive results in indicating the ChatGPT can largely provide accurate answer, but some are not. And then they found it's difficult to find references, or the references provided are inaccurate or even fabricated. And then and some studies also find out that ChatGPT lacks knowledge of clinical guidelines variations across different geographic areas. So that's in terms of the evaluation part of the study. And what about types of questions? Whether or not there are studies about, try to find out associations between the type of questions and the quality of the answers. Well, actually, there are few studies that I found. One study is using the PCOT formatted question to test the ChatGPT's answers and also the references. And the other study I found is kind of a test the closed questions versus the open questions. And then the second study, actually, the type of question is really not the major focus of the study. It's just mentioned. But then the finding is interesting is for the PCOT question, ChatGPT was not able to provide a certifiable response. So it's negative results. But then the other one, the closed question versus open questions, it seems that the ChatGPT is good at providing the basic knowledge, lifestyle, or treatment, than in the domains of diagnosis and preventive medicine related answers or questions and answers. So this is really kind of make me think about the previous slides we mentioned, like the questions, like the refinements may impact the answers generated by the ChatGPT. So because that also makes sense because ChatGPT is a large language model. So probably the language, the way you phrase, the way you use the word may impact the results. So that's actually very interesting to me, see if there is any study that can be designed to find these correlations or the associations between the types of questions and quality of the answers. So here, I just provide this very high-level general ideas about what could be done in the future. The first I already mentioned, the associations of the type of questions with the quality of the answers generated by ChatGPT. And also, is there a way to evaluate the quality of information provided by ChatGPT in answering clinical questions? Because now, so far, the studies are really using the Likert skills, using the people's subjective judgment in terms of how accurate, how well the answers provided by ChatGPT. So that would be maybe pretty reliable results, but it takes time. And also, if we want to provide a more generalized study results, using the manpower to go over the number of questions, there will be limited. So that's another thought that in my mind. And then the impact, this is just like how using the AI assistance, might improve the responses or the, some healthcare related impact. But I myself am more interested in the evaluation side of the study. So here, based on my previous study, that was a while ago. I collaborated with Dr. Cindy LaRouche about evaluating the health websites retrieved from Google. So it's really trying to figure out, what are the criteria used by the general consumers to evaluate the Google generated search results, and how to help healthcare consumers to quickly identify what are the websites, those websites that they can trust. This information is reliable for the general consumers. So the criteria actually, there are many sets of the criteria from different organizations or different the researchers, the studies, there is no golden standard criterion or unified definition for each individual dimension have been accepted. And then in terms of the website, the surveys, we call the surface markers, actually will help to provide some hints to evaluate those websites. For example, the domain name, or maybe the source. You could see who provided the information, or the copyright sign, or maybe the updated date or month. Those kind of like a surface markers that can be found from website that really help the consumers to evaluate those websites. But then the question is, can all these ideas be used for evaluating the ChatGPT information? That may be very different, because ChatGPT is really based on the large language, based on the text. So everything come up from the ChatGPT is really like a paragraph, is a text. There is no sort of like a metadata related. There is no references, maybe few occasionally, or sometimes we'll provide references, and then now the study found the references are not quite accurate. So how would we evaluate the reliability of the information from the ChatGPT? So this is like just one idea in my mind about it, how to develop a study to find out the associations with the type of questions and the quality answers from the ChatGPT. So the source could be from social media or from patient record, like my chart, or other secondary sources. The questions already there, and then I would use the Bloom's revised taxonomy based off the 6 levels of the cognitive learning to classify the questions. And then evaluate ChatGPT generated answers, by accuracy, completeness, reliability, and currency by healthcare professionals. So evaluation part, automatic evaluate, that is, to me, I need to find out more, like get more idea and get more, do more investigation, do more research about how to really provide some the methods to do that. Maybe need to work with the ChatGPT even. So, but this is kind of really the basic ideas. I certainly welcome everyone's input, and also the discussions about, how could we evaluate the information provided by the ChatGPT in the context of answering clinical questions. So here, this is just a little fun part. I type the question, can ChatGPT answer clinical questions in ChatGPT? So let's see what ChatGPT answers about this question. So basically, ChatGPT think, for any questions related to the health or clinical medicine, healthcare professionals need to be sought for medical advice. The ChatGPT itself just provides some information and as a tool to help with getting more information, but definitely not a tool or a equivalent to the healthcare professionals to provide healthcare related decisions or the medical advice. So that's some selected reference, and that's pretty much what I have for today. So I welcome the questions and the suggestions. Thank you. Oh,
so thank you. So let me start off. So, I think it seems like there's a lot of concern about, I mean, it doesn't seem like there is a lot of concern about what they call hallucination, which I call confabulation. That these chatbots are filling in a blank with the next most likely word. It doesn't mean it's the next most likely true word. It's just a word that follows it. And when I read what they write, I really get a sense of the voice of the internet. And it's like this collective voice that it speaks in. And we know that there's a lot of bad actors out there. There's a lot of misinformation. But what's even worse is that these things sometimes make up not only facts, they make up words. And so the question is, how do we make sure that something isn't going to do that? It doesn't seem to know when it's doing it. And so it can't warn you and say, I generated this sentence, but I'm not sure it's right. You might want to double check your source. It just gives you it'll say you should always check with your doctor, blah, blah, blah. Nobody's going to do that. They're going to see this statement. And so, so what do we do about that?
Well, see, this is a thing. I myself is kind of, to me, is a mysterious. Like, ChatGPT doesn't really provide the source of the information they used for generating the answers. So if that could be done, like technically can be done, can be provided by the ChatGPT, that would help a lot. And certainly I agree, if there is a little sign, the notes, if ChatGPT is smart enough to identify this as a medical related questions, if the ChatGPT can automatically provide that little notes, that's another. I think is really one side is the design aspect, like how ChatGPT is more it's not user friendly, more sense making. And then the other side is really need to educate the general health consumers to be cautious when they use the information from the internet. Well, ChatGPT, actually, the information comes from internet, or maybe they have other sources. We don't know. So another side is the educating the general health consumers is about using the information from the internet, from the tool related to the healthcare questions. That's only I can think. I myself, I'm not programmer, so I don't know technically how to really make this happen. But I believe if ChatGPT can really provide those very a large paragraph of the synthesized information for this kind of a little warning sign or the notes, by identifying the medical related questions, that's technically it should be doable.
Okay, thank you.
Sure, thank you. Any other? I saw somebody, yeah.
Sweet here. I put this as an analogy to, you have a new grad student in your laboratory, and you set them to go and find out the topic that's about maybe the lab is interested in, and they go and read some papers and they come back with an idea, and you then have to correct them saying, that's an interesting paper, but did you read this one and the one before that? And so what ChatGPT is doing is speeding up the process, but it's not doing anything to the quality. So you have to have a continuous expert appraisal of the material. So there has to be a cycle of that. Now you mentioned that ChatGPT will do that, but the public are probably not going to worry about that. As you feared, they'll take the story that they want to believe. If they see a form that looks right, then that's what they believe. Whether it be UFOs or how they, how much at risk they might be for particular clinical conditions. So it's improving the quality is fundamental, or else this will just be something that happened and it will go away because it's
Yeah.
not so useful.
I agree. Actually, this is not only the ChatGPT thing. I mean, we are in the information world. Now information is overloaded. And then we get so much information every day. I mean, from news, from even the friends, I mean, the people surrounding us, and from the internet. The ChatGPT is only the tool. But now the thing is, this is really become like, when we want to seek a advice or suggestion, are we expecting somebody tell us the answer directly, or we are actually only seeking the information so that we want to make informed decision making?
Right.
So this is really the fundamental thing for, maybe for us, we're easily for us to understand, but for the common people, they may just listen to whatever they got from the internet. So that's why I feel like a design aspect, improve the quality of the tool is very important. But then another part is really educating the general health consumers to make them embed them with the critical thinking philosophy. When they have all the information here, does it mean I can directly use that information to apply to my own situation? This is something always need a. I think this is a really huge mission, I would say, task to for the even the consumer informatics area, how to really help general health consumers to evaluate those information.
It's equivalent to what happened in, I think it was in 1490, when the printing press was invented. So we went from a stage where the writing down literally had to be written. It was in the hands of very few people, mostly the wealthy and the church. And then all of a sudden there was a way of printing that information and giving it to the public. So it's really no different from that. So historians can analyze how the printing press evolved. Of course, we do have great literature that we've all been exposed to as a consequence of that. But yeah, I think the quality is the really hard part. It has to be done.
Yeah, definitely. Both sides, I think, to me, is like is the information is like a system or the tool interaction with people. So both sides, we need to work on both sides. Improve the quality of the system or the tool, at the same time educate users. When they interact with the system, how should they respond or react to the information they receive from the system or the tool? So feel like it's not only for educating, not only to educate the adults. I mean, even from when the kids, they are young, like a teenager, we need to have them to really have critical thinking embedded into their daily life. Yeah.
Thank you.
Sure. Thank you. I saw another question from the chat. Who would be responsible for or liable for advice generated by ChatGPT, especially in situations that results in patient harm? Well, this is really the ethics related questions. I mean, we all are interested and wanting to know the answer. This is actually make me recall the decision support system. When the doctors use the DSSS, to make the medical related decisions, what if, the DSSS gives some, like, if not wrong, but really some unreliable information. And then based off that information, the doctor make decisions and then do some harms to the patients. So who should be reliable? So is the system, is the machine, or is the people? So so this come back to the question, how do we view ChatGPT? What is ChatGPT? Is it a tool, or is this your brain? That's really my personal opinion. Because I believe the relationship between the human and the technology, I mean, now technology goes to the AI, it's like so many people talking about, oh, if AI could replace human even. Well, and also if you like to watch movie, so many movies, right? With the fantasy, those the movies with the superpower, they are kind of like a human actually developed them, but then eventually they come back control the human. So I mean, like for any technologies, human and technology the relationship, I still believe a human should be in control. And then in terms of the information received from the technology, still it's up to us to decide how are we going to use that information. So this is a thing. To what extent we want these tools or the systems can help us speed up our process, but at the same time also keep good quality of the work. So I think the question is really, we need to answer the questions as a human. Okay, and yeah, I hope that answer your questions. That is really, I feel like, I don't know for the policy wise or the regulation wise, feel like it's already in process. As far as I know, or maybe at least in the starting stage. That's definitely should be the policy or regulation should be in place in terms of this kind of liability issues. Let's see what others is the comments. Prompt engineering and the recent powerful models. Okay, yeah, 4 can improve the results in manifold. Yes, I believe so. But GPT-4 you need to pay. Now the 3.5 is up to 3.5 is free, but then up to the GPT-4, then you need to pay. So I don't know how many common people, like general consumers, they would like to pay in order to get a higher, quality of the information. So that's another question then. Yeah, I totally agree. ChatGPT is trained on the internet. So if the internet is wrong, it can arrive at wrong conclusion. So that's come with the question that I have. What are the sources of the information that ChatGPT use? If all the information come from the internet, so which means the free information, the information free available from the internet. So I would say, in this case, I would feel like a ChatGPT is the advanced version of the Google, sort of. Certainly, it's more advanced because ChatGPT can generate the written answer for us. It's not like in the Google search engine, we need to search and then we need to go through the results and then we come up with our own, paragraph. But ChatGPT, because of the learning, machine learning, the power. So that's definitely is the advance, a huge advance. But then at the same time, the same question for everyone: how would we, if the information retrieved from the internet is reliable, how do we know it is reliable or not? So to me, it's very interesting to see if there's some research can be done, especially more practical research that can generate some automatic tool to help general health consumers to evaluate the online information. So when I did my previous study, at that time I found only 2 automatic tools available all over the world. One is from Australia, one is from UK. So I don't know, because I'm kind of a stop for this topic a few years. I don't know if in here, not in the United States, there are already some automatic tool existing, so that the general consumers can use that tool to provide a sort of even just categorized the rank of the source of the information, so that they know what sources of the information is more reliable for them.
This is Amy Wong. Yeah, thanks for the great talk. Just a couple quick comments based on the things that you've brought up and some of the things that have come up with the questions. You mentioned what are the sources? So sometimes I've asked for sources or references, and it will give some to me that at least I know something where it got the information. I never know if it's sharing everything or just being selective about sharing the good ones. But also, since your background in library, information library, and library science, what about using it for asking for those references? Like, oh, can you, for a patient or provider, I want to know what do the guidelines show, what's recommended for me to find, for me to treat this condition. So how is it for that? Is that pretty good? Because that's just providing information, or even that can be problematic because there's so many questionable, shady resources out there.
Well, actually, this is a very good question. Within my review of the literature, I listed two articles specifically evaluate the references provided by ChatGPT. Unfortunately, they found the references provided by ChatGPT are not accurate, not like we would hope the references should be 100% accurate. I mean, maybe like what I mean is the element or the component of the citation may have some error, but that's not like, it's maybe just some typo or the not like the wrong or inaccurate references just for the sake of providing the references. You know what I mean? But then it seems that the results from those studies is really they are kind of provide negative results in that regard. So I'm sure, yeah, certainly we can ask directly typed, what are the references, what are the sources that I can use to answer this question or solve that problem in the ChatGPT. But whether or not it can provide a reliable resource, I don't know. I mean, I would be curious, I don't know, like, do you have any question in your mind? I mean, we can try now. I have my ChatGPT open. We can even try to see how it come up with.
I feel like that's a bit risky. We don't know what rabbit hole ChatGPT may take us down. Yep. Although I guess that could be fun, but maybe I don't know. Yeah, it's the right format, the right forum for that. You mentioned about the science fiction, like, all these disastrous AI causing all this harm and everything. There are also a lot of portrayals of AI physicians. So I feel like that could be something good. It's like you mentioned about the decision support, that it's a tool that even with decision support, if you follow the bad decision support advice, a physician would still be liable, that they still have to use their own judgment. You mentioned always have to have a human there. So so I mean but I'm wondering that since it comes across so much like a human, and even now it can talk back to you, that people tend to think of it as if they're asking an expert for advice. And now that the cat's out of the bag, and you don't know if you're getting the best one or if you're getting 3.5 or 4, and there's not good education about it. Not everybody will go through to get the training for it. You're right. It's like Google, people will do it and then accept it as the truth. So how can we, any ideas about how can we help people to use it better? And people are not going to take advantage of that kind of training, and it's there, and it's just so easy. It's ubiquitous.
Yeah. Well, to me, I mean, like from being a librarian background, not informaticians, if the librarian background, I think it's really like verified information from different resources. That's one way, really the practical way to help. But then the thing is, for the general health consumers, if they know there are resources available for them. I mean, like National Library of Medicine provide a lot of free resources that everyone can use, but then how much, how many of the resources, how many people know about those resources? So this is another, come down to the educating, being awareness of the awareness issue. So that's a lot of work to do actually, but then I still feel like, well, my research are really focused on the, as you mentioned, the design part, human factor. If whenever we design a system or a tool, try to make it more user friendly in the sense that map or match users information searching behavior, like their habit, rather than ask users to adapt to the system's structure. So this is really, maybe it's pretty too ideal. It's in reality, it's hard to achieve, but still this is something, will help. Also help when the people use technology, when they interact with technology, the technology is designed to really customize the way that the people use, then the results we will get better results, because the users do not need to make too much effort to try to figure out how to get best use of the technology. And I think your question about references, ask about ChatGPT references, that's actually another good study to test. Yeah.
There's a wealth of information here about potential research topics using ChatGPT. Also, talked about following on Kevin's comment that the internet has false information or incorrect information, and so ChatGPT reflects that ChatGPT is not really a monolithic thing, because you can use that model to train it on anything you want. So I wonder if you're aware of, or what you might think of, training it only on trusted and reliable information or health information, such as guidelines or literature. Actually, the literature can be self-contradictory too. So so just trained on trusted information or health information.
Yeah, that's a very good idea. But then the thing is, practical guidelines might be easier to access as a free resource. Like what I mean is accessible. But for many journal articles, like scientific publications, once they go to publishers' hand, the publishers own the copyright. So how the ChatGPT can get access? The ChatGPT asks for permission in order to access to those resources from publishers' website. So that's another kind of a little. It's something that need to talk about, because in terms of the licensing wise, it's very strict, unless it's open access journals, right? And there are different levels of open access. So this comes to another issue, open science. If we really want to, have a ChatGPT trained on the reliable resources, how could ChatGPT access to those reliable resources, and then also can make that function available to the general public? Okay, what is a reference for clinical questions? Knowledge encoded in me. Okay, thanks for sharing. Yeah, from the chat. Diverse range of reputable sources available. Okay, last training 2022. Okay, nice. So you have a higher version, I believe. Okay, medical textbook, clinical guidelines, public health sources, trusted medical website and database. Ew, do not have capacity to provide specific citations or references for each piece of information. Consult the latest guidelines, primary literature, and appropriate medical professionals. Well, it did give us some resources, but then well, I guess here come with the question like in the information science field, the scope of the information. Like, although ChatGPT have all these reliable sources, it's like a database, like our bibliographic database. None of the database can include all the publications in the world. So each database has certain like scope of the information that they can offer. So for the is this also the case for the ChatGPT? So are those medical textbooks are the e-books that the ChatGPT can be accessible? What about okay, prompt is the patient record, patient specific questions.
Let me try asking the question.
Okay.
So
Thank you.
So if you can put in information into the chatbot, and that's called the prompt, right? So if I take a patient record, like for instance, suppose I take a pathology report or a radiology report or a discharge summary, and I put that in as the prompt. And now I'm going to say to whatever, I say, this is a report about my patient. And I put the information in, and it says, okay. And then I say, so what should I do for this patient? Or what does it mean? What does this report mean for this patient? And so, it may pull things from its knowledge base that turn out to be made up, but will it make up things in the prompt? That is, will it say, for instance, for instance, suppose I didn't say what the gender of the patient was, and would it make up the gender and say, oh, this woman has at risk for this, or this man is, or, does it only do that from the knowledge base that it's been trained on? Does that make sense?
Yeah, I understand. I think this is really the context of the question. I mean, like demographic information is a part of the context. It's not only the medical question per se, it's also, the questions surrounding the medical questions. So this is the part I think is very interesting. I forgot which article I read. The author questioning about the ChatGPT's capacity to like catch the contextual information. So to answer your question, I think I don't know. I think this is another good study actually to test. But then one question is, of course, I'm sure when you put up the patient record information, it's already de-identified. And then whether or not it is information, the text itself, or is the image. I think because of the higher level, the ChatGPT also can process the image, right? The input, the prompt. So that might give a little different, maybe because if you provide an image, but then you de-identified without name, without, those personal identifiable information, but then you keep maybe gender, you keep the medical condition, or maybe age, or if ethnicity group information is there, that might give a more completed information to ChatGPT, and then the ChatGPT can detect those information and then provide more provide the information, provide answers by considering those contextual information. So I don't know. I think this is also very interesting. And also whatever ChatGPT come up with is still up to health professionals to decide whether or not I want to accept, I want to take that information, directly apply that information. So still, it fundamentally still up to human. Yeah. 4, okay. Oh. Yes, it's always best to refer to primary literature. So then the thing is, okay, when it comes to clinical or medical information, it's always best to refer to primary literature, up-to-date guidelines, or consult with healthcare professionals. Now the question is, I have the ChatGPT answer. So how could I convert that answer to find the primary literature? How could I do that? So does it mean like I still need to search bibliographic database or search Google Scholar in order to find really the original studies? So then if in this case, what is the function of the ChatGPT in this sense? So which means I need to verify ChatGPT's answer from other resources as recommended by ChatGPT itself. Okay, they have a PubMed. Okay. So Kevin, so these are the list of the resources that ChatGPT provide. Your picture. Okay. Yeah, the FDA, some government. Yeah, those are actually good. The clinical trial, PubMed, Medline Plus, CDC. Yeah, those are good resources. But still remember, these resources are not complete resources that are available to get, maybe for certain questions, the information, resides in these resources are not enough to answer the questions that you ask. So there's some limitations. What I think my point is, because of the source of the information that ChatGPT rely on, there's some limitations that limitations of the answers that ChatGPT will provide. Yeah. So and what? Oh, I'm sorry. Just
do a quick check on time.
Yeah.
We've got 5 minutes
Yeah.
left, so everybody knows.
Yeah.
But thanks for everybody for the great questions and discussion.
And one more question is, now I know there's already some tools that kind of counter the potential plagiarism of the writing come from the ChatGPT. So is there possibility like we could have some tool to really also evaluate the information come from the ChatGPT in terms of the medical, in the medical field, the medical questions? Kind of borrow that idea, borrow the writing, plagiarism, checking idea. So that's another thing I would feel like would be very interesting to see. Oh, wow. Knows everything, but doesn't know how. So only know what, but not know how, not know why.
It's a bit of a black box, isn't it? I just quick comment on since Dr. Cimino talked about clinical reports, EHRs and things. So I don't know if anybody has access to the Mimic database. It's on PhysioNet. That's a EHR data that's publicly available. And they actually have on their website that they had people that asked, can I just put things into ChatGPT? And that would seem like that would be a good way to learn. But because they have restrictions on how the data is being used. You know, only you can use it. But if you put it into ChatGPT, it goes into the ChatGPT cloud, and then, you know, whatever, you lose control over it. So they don't allow people to put it into ChatGPT. And kind of in the same vein, if you put EHR data into ChatGPT, there's questions of privacy and confidentiality. I mean, I know things can be de-identified and things. I don't know if, you know, I know you were focused a little bit more on what patients would use. So I don't know any literature or thoughts about the patient confidentiality issues that I know people have their own walled off ChatGPT, so that would work. But if people are just typing things into there, pasting things into their own patient data, then it's already out there.
Yep, that's the issue. I mean, even personally, like a patient themselves, they type their own questions, although without like identifying information, but that's pretty much their very personal. Sometimes maybe they type very personal the question. And then if you think about this kind of information, more and more, this kind of a personalized questions, you know, goes to the model. And then what are the answers might be generated in the future. And I think for the healthcare professionals, we all know the HIPAA, so everyone should be very cautious to input the patient data, the real patient data, into the ChatGPT. I mean, it's not like you cannot, but maybe, yeah, really strictly de-identify the information, the patient information. Just focus on the problem, the health problem. Okay.
So we are at the end of our time, so just be respectful of everybody's time. I don't know if you're available, if there's still questions. There's still some 20 people on the call. Are you still available, or do you need to go to another meeting?
I have some time. Yeah, if people want to chat about it, or, you know, always welcome to contact me. If you have some idea and want to collaborate with the research in this area. Yeah, thank you. All right, thank you very much.
Yeah, all right, well, yes, thanks again. Have a nice weekend, and thank you to Dr. Tao for her very informative and enlightening presentation, everybody for your questions and comments and discussion. We hope to see you at the next Power Talk, and also in about a month, if anybody's attending the FAMIA conference, and that would be a great place to network as well. All right, thank you, everybody. Bye-bye.
Thank you. Have a good weekend. Bye.